But imagine if your job in life as a leader is to teach your staff how to make patients feel safe and secure, period. That's it. Let's make that like the overriding theme. I loved her idea about having posters around that said, just do your best. Now, I'd like to define what do your best means, because not everybody knows when they show up. I'm just doing my best. No, you're not. You're sucking the life out of me. Right? Some people have a highly inflated feeling of how well their best is, I guess. But if we could define it as do your best means patience, see, it's no longer what we think. It's really not about how well we think we're doing. I love it when CEOs stand up and say, we're great, we're wonderful, we're the best, we're this, we won these awards. What I want to do is I want to ask every patient when they walk out the door, did you feel safe and secure? Maybe that's just the answer. Maybe now instead of asking HCAHPS or CGCAHPS or any of those surveys, maybe we ought to just ask that question. Because I can't imagine her thinking of going anywhere else for her care. Because I don't care what your job is in this organization, whether you touch patients or you support those that do, that was some powerful stuff. Simple words, simple person, grace and dignity. Did you detect that she was full of grace and dignity? Did you just get it? Man, I wanted to spend more time with her. I wanted to hear more because I thought I could use more grace and dignity in my own life. She's dying, and she taught me how to have more grace and dignity today, and I'm living. Isn't that pretty cool? She said, I walk in the door, I feel like I have no control. I've had to take some control of my own health care. We subject her to some people that ought to find something else to do. I don't think that's right. She seems like a nice lady. I wouldn't want her to be in pain or be afraid or be anxious or be worried unnecessarily just because our job's hard. See, it's one thing when it's like an initiative or we're doing leadership development. It's another when you have to look her in the eye and say, I'm sorry it didn't go well because of that guy, and we knew he's been here, and he's been here for 22 years, and we just haven't done anything about it. That's hard to do. Who wants to do that? We need a volunteer to do that the next time she meets one of those people. It's going to be you on your blog, or now she's going to call you directly. Remember me? Right? She got a hotline to your office? Yeah. She's got a hotline to his office. If she comes and hangs out where you work, don't let her meet any of those people. Hide them. Tie them up. Or help them find another business to work in. Come on, am I wrong? Tell me I'm wrong. And I'm not saying nobody has a bad day. I have bad days. I have bad days. Can't let it affect you, though. I'm not allowed. I can't come here and have a bad day. She said a couple things that clicked in my brain that ties to work that I know you're doing and work that we do. I'm going to tell you some of the bullet points and tell you what I thought of when she said them. Safe and secure, she said several times. I wrote it down several times. Teamwork. Seems like, and she did make a connection to the electronic portion of teamwork. That's great. But just because it's in the system doesn't mean I use it. So what I heard is people using it. I like that. I like that a lot. I know in an organization your size, with the number of people you have and moving parts you have, that's not easy to do, and it's not easy to do consistently. I know it's not. But if we take a snapshot of what she said, that was a really good place to start. You're better than the average bear. I do this a lot. I go to a lot of places. That part of the conversation would have never happened. That integration between sites and locations and providers, that's the dream of organizations today, and they don't even know what it looks like at the end. You sort of have a glimpse. That's excellent. She talked about the little things, and I wish I'd heard more about the little things, but I did. I think I heard enough. She talked about patient education. When she said patient education, the first thought that popped into my head, I wrote it down, was ADET. ADET. The E in ADET is explain. She just asked us to do what you already know to do, and it's not hard to do, and it's just tell people what they need to know to make good decisions, to understand what's going to happen next, and ultimately to reduce anxiety, which I think the equation, if I reduce anxiety, that equals I feel safe and secure. See, she was basically saying you reduce my anxiety without using those words. Do you agree? Yeah, I think she was. And she said several times, educate us, educate us, educate us. That's the E. Tell me what's going on. Tell me what's going to happen next. Tell me what I'm supposed to know. People are dying for that. They want to know. Because then they make good decisions. They participate. They give us advice. Here's what I'd love. I thought about this a moment after she said it. She said that she always, when she's in CT scan, she always has a pillow behind her neck, and she always has a pillow under her legs. And by the way, I think that's just excellent. I'd like that, by the way. I'd like that while I was sitting here. And I'm not even, you're sitting a lot longer than me. I hope I don't cause any bed sores today. But what I heard, and then I heard, well, we know when her test is, and we know what her test results were. You know what I was thinking? Immediately popped into my head was Ritz-Carlton. See, Ritz-Carlton is really good at making you feel safe and secure. Maybe not safe, but good. You feel good, right? True? True? Even if you've never stayed at a Ritz, you know that they're really good at what? Service. They're really great at service. See, she didn't really once talk about the quality of the image of the MRI or the CT. She has no clue whether that she said it was like a command center. I almost expect her to say NASA. You know, we got all those monitors. She has no idea if that stuff's good stuff or not. What she said was, I'd like a pillow. Did you get it? I want people to tell me what's going to happen next and give me a pillow because my back cramps up and it's uncomfortable, and she has to have a lot of them. So when I thought of the Ritz, you know what the Ritz is good at? They put your preferences in a little computer. So when you go back, they say, Mr. Murphy, we see last time you asked for extra pillows in Texas. Would you like them here? That would be cool, wouldn't it? Why wouldn't we write that one down somewhere? I bet there's like a note section. Some free text. Sigh likes a pillow behind her neck. Imagine if the next time she walked in, they said, welcome. We know you're here for your CT scan. I reviewed your profile, and I know that you like an extra pillow behind your neck and below your legs, by your knees, to make you more comfortable. She would fall over in shock. Now, some people remember it, and they do it for her because they know her. But what about the person you hired yesterday? How long will it take them to learn? I just think that's the next level of how do you use this magical system that connects you all to write down the stuff that people care about. So the phrase that entered my brain was individualized patient care. You called it patient-centered care. We actually teach a module. We teach a philosophy on how do we ask the person what they want, write it down, and deliver it consistently from now on. It's harder to do than it sounds, but can you imagine how she would feel? She'd have a parade in your honor over a pillow. I thought that was pretty cool. God bless you. She said the checklist to keep me safe before surgery. Now, I didn't know exactly where she was going with that, but she seemed to wish we used checklists more. Did you get that? I didn't get the impression there were too many checklists. Did you? Okay, I want to make sure I didn't read it wrong. What I got was there were some good experiences and some not so good experiences, she said, and if you just used a checklist, maybe you would have remembered some stuff. She said a word, I don't know if everybody heard it because it was buried all in the real good stuff she said, but I sometimes are listening for the stuff she wanted to say but wanted to be really nice to us today, I think. She used the word inconsistent. I wrote it down. Check the tape. So what's that mean? It means that's pretty cool. We know that already. You as leaders know that already. We are actively trying to go from usually to, see, she just saw examples of we're right, we're working on it. And I like that. I mean, the amount of time, can you imagine, if you add it up, somebody's done this, I'm sure, the amount of money that's involved right now just to make you better leaders? She said, I want people to come to work with this on their lips. I'm going to do my best today. Wow. If every hospital on earth did that, I wouldn't have a job. She said, you know what would be really cool? If everybody would just look at me and smile at me. Make me feel connected. I wrote the word connected. I'm thinking, okay, Frank didn't have to, but everybody else does. That's why I'm dying to know, how did Frank make her feel so good and he wouldn't smile at her? I don't get it. I don't get it. Can't you do both? I just wonder, can you do both? I think you can. But I'm not going to stay on Frank because it was a compliment. I'm not messing with it. And then towards the end, she talked about this pat on the shoulder. So when I heard her talk, I was in my mind I was thinking of ADET. And you've done this big teaching all across, like 90% of everybody's been trained now in keywords, yes? So I thought of the A, smile, look at me, make eye contact, make me feel connected. She asked for that. This isn't Studer Group or Bob Murphy. This is Sai saying, look me in the eye, smile, act like you know I'm there. Make me feel important. Make me feel like you care about me. Did you hear that message? Okay, the I. Introduce yourself. She didn't talk about it a lot, but it's part of making me feel safe and secure to let me know that you know what you're doing. She's met a lot of healthcare providers. Imagine if she added up all the people she met. How many of them she felt good about and how many she didn't feel good about along the way? How many that she knew right away, they knew what they were doing right away? Like Frank, something about Frank. Let her know she was in good hands. We got to duplicate that. That's all the I is. I know you're teaching this all across the organization, but staff are going to need constant reinforcement, constant, relentless, laser-like focus. If you want ADET to stick, if you want keywords at key times to reduce anxiety to stick, you're going to have to talk about it every day for the rest of your life. It's not a program. It's not an initiative. It's not a class you take. It's the way you live here, I think. If you want it to be really good, you got to make it the way you live, which means we got to tell her story and tie it to ADET. We got to say, see, here's what she told us on that video. She told us, look people in the eye, make me feel safe and secure. Tell me what's going to happen next. Here's another thing she said. She said, all I'm doing is waiting from test to test. There's a lot of waiting. What comes next? Well, maybe if we told her how long stuff would be, she'd have a little less anxiety knowing how long she was going to wait. Now, she's an intelligent consumer. She's an intelligent patient. She probably says, how long will that take? When will my doctor get the results? Can't you just picture it? Like her surgeon who said, what did she say? I think I talk too much. That's why I take a lot of his time. Wouldn't it be nice if we just told her without her having to ask? That's all ADET is. It's not rocket science. And many times, obviously with her responses, many times you did. I just want to be more consistent. And I want to think about every other patient but her. When she walks in now, she'll be a celebrity. You'll be like, hello, I know you, I saw you. She'll get that level of care. I want it to be the next person who walks in 5 minutes from now while you're here to get that same level. The E she talked about. And the one that didn't come up, but I think it's part of being our best, is the T, right? The T is what? Thanks. Aren't you great? I heard you say it. We're grateful for the honor to serve you and take care of you. And if you need anything else, just ask. We'll do anything we can. That's what the T is. We're grateful. It's exactly your words, but us all saying it every day to everybody we serve. Thanks for coming here. Because she could go somewhere else. Her husband, her friends, her family. Every time she leaves here, she's going to say something good, something bad, or nothing about her care. What do you need her saying? Good stuff. Are you grateful for that? Are you thankful? Tell her. Not just her. She's our one example today. But I mean the many, 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 many thousands of others that you interact with.